Welcome to Free Unbiased News. Today, we'll be covering a new variant of the coronavirus from South Africa that was located in the United States. Let's get into the details. Normally, I like to look at the headlines first to try and identify any bias, but in this case, that isn't necessary. The first article we'll be covering is from the Associated Press, written by Michelle Leo, who is a reporter for the Associated Press, and Mike Stobbe, who is a national medical correspondent for the Associated Press. The article begins by informing us that a new variant of the coronavirus emerged Thursday in the United States. The mutated version of the virus, first identified in South Africa, was found in 2 adults in South Carolina. The 2 people are not connected and said to have not traveled recently. They mention way down here, the 2 people were tested early in the month. Both are reportedly doing well and are no longer contagious. Public health officials said it's almost certain there are more infections that have not been identified yet, and they're concerned that this version of the virus spreads more easily and that vaccines could be less effective against it. They elaborate down here. Scientists reported last week preliminary signs that some of the recent mutations may modestly curb the effectiveness of 2 vaccines, although they stress that the shots still protect against the disease. There are also signs that some of the new mutations may undermine tests for the virus and reduce the effectiveness of certain treatments. Now, if scientists reported this last week, the 2 vaccines that I'm familiar with are from Pfizer and Moderna, so I wonder if they are specifically referring to those. They continue with a couple of quotes. Take a look at this one here from Dr. Krutika Kupali. They report that she literally said, "That's frightening and it's probably more widespread," but they add clarification here by adding, because it means there could be more undetected cases within the state. Dr. Brandon Traxler, interim public health director, said the fight against this deadly virus is far from over, and he also mentions that vaccines are on the way but are in limited supply. The article goes on to mention that researchers are concerned with 3 variants of the coronavirus, which is believed to spread more easily. Here are the 3 variants they're referring to. One emerging from the UK, known as B117, another from South Africa, known as B1351, which this article is referring to, and a third from Brazil, also known as P1. The article goes on to mention that lawmakers in several states are pushing back against mask mandates and other protective restrictions ordered by governors. They specifically mentioned states like Arizona, Michigan, Ohio, Maryland, Kentucky, and Indiana, as well as Wisconsin, and down here, Nebraska, and South Carolina. The article concludes by mentioning President Biden's pledge to deliver 1 million injections in his first 100 days in office, and also that he has reinstated the COVID-19 travel restrictions on most non-US travelers from Brazil, the UK, and now South Africa. Now, I should mention that the Associated Press normally remains neutral and they rate at the top in original fact reporting. CNN also covered this story with an article written by Michael Nettleman, a producer at CNN specializing in health and medical stories. For those of you who don't know, CNN has a reputation for leaning left or favoring Democrats, but they rank pretty well in regard to reporting the facts. This article's headline reads, "South Carolina detects first U.S. cases of coronavirus strain first seen in South Africa." This article starts by informing us about the confirmed cases in South Carolina. I do like how all the information is together here, noting that the 2 had no connection, they were tested in early January, and that both were no longer contagious and doing well. For this information, CNN used the same source as the Associated Press in Dr. Brandon Traxler, but also added that it takes a while for sequencing to be done. Sequencing is a term for detecting and characterizing coronaviruses. She mentions that one case was confirmed late yesterday and the other was identified while testing samples over the past several days. One thing I found interesting between the Associated Press and CNN's articles are the different perspectives of Dr. Traxler's comments. Here, CNN reports that Traxler said, "We do not have concerns at this time, about there being potential for mass widespread transmission, and that the predominant strain that we are still seeing in our surveillance sequences is the standard or normal version of the virus." Now those three dots are called ellipses, and they are used for omitted material within a single sentence. We'll get to the omitted material in a little bit. Now, CNN gave me the vibe that Traxler is confident that we're all good. And if we look back at the Associated Press, they report Traxler saying, "The fight against this deadly virus is far from over, vaccine supplies are still limited, and we must recommit to the fight by recognizing that we are on the front lines and in this together." That makes me a little bit more worried. After watching Dr. Traxler's actual statement, she does mention that the UK and South African variant spread easier, but there is no data suggesting that the illness is more severe. This is reinforced by a statement released by the CDC. She also mentions that both Pfizer and Moderna's vaccines are still extremely effective, and Moderna is developing a booster that may enhance the amount of protection that is already provided. Now, back to the ellipses. Here's a quick clip of the full quote.
Do we have any idea from contact tracing how many others these two cases have been in contact with?
We do not have concern at this time based on their contact tracing about there being, the potential for any mass widespread, transmission.
I'm happy to see that no important information was excluded, and the article ends with Traxler's quote about the fight being far from over. The final article is from Fox News. Now, Fox News doesn't have the best reputation. Some consider them hyper-partisan right. And when it comes to reporting facts, it's been proven that they are sometimes selective and provide incomplete facts. Now, this is not always the case, but it has been proven that sometimes it is. With that being said, let's see what they had to say. The headline reads, "First U.S. cases of South African coronavirus variant identified in South Carolina." This article was written by Madeline Farber, and she is a Fox News journalist. This article contains a lot of the same information covered in the first two articles, so we won't go over those again in this one. They too provide quotes from Dr. Traxler, but they add a little bit more of what she said. "We know that viruses mutate to live and live to mutate. That's why it's critical that we all continue to do our part by taking small actions that make a big difference. These include wearing our masks, staying at least 6 feet apart from others, avoiding large crowds, washing our hands, getting tested often, and when we can, getting vaccinated. These are the best tools for preventing the spread of the virus, no matter the strain." Fox also provided more quotes from the CDC about the continued efforts to monitor the presence and impact of variants in the US and around the world. The CDC also recommends people avoid travel at this time. They go on to mention that the vaccines still remain effective against the virus variant, but make sure to add that the results of the study have yet to be peer-reviewed. They also refer to the vaccine as the COVID-19 jab. Now, the term jab is used in the UK, replacing what we call in the US a shot. I'm not sure why exactly she decided to phrase it like that, so you be the judge. In summary, all three of these sources covered this story accurately and without any blatant bias. I hope seeing these three articles together gave you a better idea of the full story. If you want to read these articles for yourself, the links are in the description, and if you have any input or questions, feel free to leave them in the comments below. If you feel like we earned it, we appreciate you hitting that like button, and if you want to get more news like this and future live coverage, make sure to subscribe. Thanks for watching.